In addition to premature aging, the delicate skin around your eyes can also be susceptible to skin cancer. Joining me is Dr. Jerome Potozkin, board-certified dermatologist and spokesperson for the Skin Cancer Foundation. Doctor, thank you for coming in today.
Thank you for having me.
I mean, we hear a lot about skin cancer, but I guess I'm not that familiar with skin cancer around the eyes. What part in particular are we talking about? Like under, on the eyelids?
Well, it's actually pretty common. Skin cancer is the most common cancer affecting mankind and in the United States. And it's estimated about 3 million people will be diagnosed with skin cancer in 2020. And of those skin cancers, about 5 to 10% are eyelid skin cancer. It can be either the upper eyelid, the lower eyelid, or even in the little crease right next to your nose.
Is it just because we aren't putting sunscreen close enough or in that area? I'm not sure the directions on sunscreen, if it even says to avoid the eye area or...
It's really a matter of, it's just an area that's exposed to the sun. So most of the skin cancers, 85%, are on the head and neck. And our eyelid skin is thin, delicate skin that's exposed to the sun. It's getting sun damage, and it's a very common area to develop skin cancer. And it's one that most people don't expect to get skin cancer. So it can be a small little red area that's not healing. It could be a new little bump. Sometimes it doesn't look like a typical skin cancer. So it's really important if someone notices something on their eyelid to get checked out by an expert.
Okay, oh yeah, you're seeing some pictures here on your screen, because generally when we think of skin cancer, you're looking for what, irregular edges on something, on a mark, it getting bigger. Is it something like that as well, where it would get bigger?
So that's a great point you bring up. You're talking about melanoma skin cancer, which is usually a dark spot with irregular borders, irregular pigmentation. The most common skin cancers we see on eyelids, though, are non-melanoma skin cancers, the most common being basal cell carcinoma, which often appears as a little non-healing sore. It can be a little area of redness or apparent irritation that doesn't go away on the skin.
Okay, what's the prognosis for it?
So the good news is prognosis is excellent. Almost all skin cancers can be treated. When we see non-melanoma skin cancer on the eyelid or around the eye, we typically do a very specialized skin cancer surgery called Mohs micrographic surgery. That is the microscopically controlled removal of skin cancer that allows us to remove tissue layer by layer, checking it under the microscope as we go. This allows us, number one, to get about a 97 to 99% cure rate. And instead of taking out the entire eyelid, we take out the smallest amount of tissue possible in order to get that skin cancer out.
Okay, so a good question, I guess, would be, how do we try to protect ourselves? Is it, do sunglasses help? Should we just be putting more, I mean, I know it's delicate, but should we be putting more sunscreen in that area?
So sunscreen is critical, and a lot of people prefer an organic sunscreen, one that has titanium dioxide or zinc oxide, because of the delicate tissue of the eye. And then the number two thing are sunglasses.
Okay.
And these types of sunglasses are the wraparound types that protect all the eyelid skin. They might not be the most stylish. They're usually for people that are very secure in themselves or in the committed relationship. They're not Ray-Bans or super stylish ones, but they get the job done. They block out 100% of the ultraviolet light, and they also have the side pieces that get the skin on the side.
Yeah, because most sunglasses, they look cool, but really there's a lot of sun exposure from the side, the top. It doesn't do a lot of protecting.
Exactly.
Okay, well, doctor, thank you for coming in and giving us some good insight on this. We appreciate your time.
Thank you so much.
All right, Dan.
That's great.